Hi, this is Dr. Bragg with a tip for a pain-free Friday. Last week we talked about what are the characteristics that describe a person who's addicted to a pain medicine. And we reviewed the 4 C's of addiction, which dealt with cravings, where you want a drug like you want food or medication, compulsive drug behavior where it's irresistible, loss of control, and where you want the medication despite negative consequences. You may be nauseated, vomiting, sleepy, and not functional, but you still want that medication. So those are the 4 C's of addiction. After I did that, many people emailed me and asked me if I could let them understand what's the difference when someone is taking the medication the right way. And so today I'm going to talk about 3 terms that I hope you can understand. One is dependence, the second is tolerance, and the third is addiction. And these are 3 things that can happen when a person takes pain medicine, an opioid. Now, whenever you take an opioid or a narcotic for a medical condition, you can become dependent on it, meaning that you need the medication for controlling of your pain. But a person who is dependent is not addicted, and they don't want to be called an addict. And so you need to make sure that you are not erroneously categorizing someone who is dependent on the medication an addict. And so I'm going to tell you about a story. Years ago, I had someone who worked with me. I'm going to call her Mary. And Mary was a very good assistant. And Mary would come in and she could work that waiting room. And she would load my exam rooms. And I said, Mary, oh my God, you've done such a good job. And I noted that when Mary didn't have her 12-ounce soda, she was slow, sluggish, had a headache, and very irritable. It got to the point that when Mary didn't have that soda, I was putting that soda on her desk to make sure she had that soda because I knew we were going to have a good day. This could happen with a friend of yours or someone who works with you, a coworker who loves to drink coffee. And I know you've noticed them. They are irritable, and you don't want to be around them before they have that cup of coffee. And you may even ask them, Sue, Bob, have you had your coffee? Much like Mary needed that soda. Well, things went on as time went on. Mary was drinking that 12-ounce soda, and it wasn't doing for her what she used to do because she was still irritable. Mary had gotten to the point that she needed a 20-ounce soda to do what a 12-ounce soda used to be. So at that point, she had become tolerant. Tolerance is when maybe you were taking a pain medication, and now instead of 1 tablet, you need 2 to get the same effect. But tolerance can also indicate that some person's disease process has progressed. And this occurs just like with your person who drinks coffee. They suddenly now need 2 cups of coffee to get the feeling from the caffeine that they used to get from 1. And so that's tolerance. So some people can become tolerant to a pain medicine and they're still not addicted. Well, one day, I'm just illustrating a point so you understand. Someone called and said, Dr. Bragg, Mary, she's downstairs, almost want to choke somebody and take $2 for them because she needs a 2-liter soda. And I said, Mary, what is? She said, Dr. Bragg, I have to have this soda. And just like it would be rare for someone to choke someone and to really go after them for a 2-liter soda, it is rare that all persons who take pain medicines become addicted to it. Research says that only 3 to 19% of people who take pain medicines become addicted to it. And so I'm not saying that a person is addicted to a soda. So I'm using these as illustrations so that you can understand that people who take pain medicines, all of them become dependent, much like your friend who has to have a soda in the morning or a cup of coffee. And they can sometimes over time become tolerant, much like your friend who now needs a 20-ounce soda to do what a 12-ounce soda used to do, or your colleague who you know now needs 2 cups of coffee, and then There's that person with that compulsive drug behavior, much like the person who needs a 2-liter soda. Now, I hope you understand these terms: dependence, tolerance, and addiction, and know that people who are dependent on the medication need it for pain relief, and they are not addicted to the medication. Now, please comment below if you do not understand what I'm talking about, or if you need further clarification, because my goal is to help you understand these 3 terms that we must understand when we're talking about treating people with long-term pain medications. Now, please subscribe below and share this with a friend.